Hi, welcome back to Parenting Dyslexia 360. For those of you who might be visiting for the first time, I'm Christine Patterson. I'm a pediatrician and I'm a mother of a child with dyslexia here to support parents who are on a similar parenting journey. Today, we are going to talk about intervention. So in previous videos, we have talked about why it is important to make an early diagnosis label of dyslexia. We want to know about dyslexia as early as possible so that we can put intervention in place because that's when it works best. The younger the child is, the better it works. And that intervention is called structured literacy. And there's a very specific kind of structured literacy called the Orton-Gillingham approach. And I want to teach you more about that today. So the Orton-Gillingham approach was developed by Samuel Orton and Anna Gillingham back in the 1930s. Some people in the field just call it OG. Insert all sorts of jokes about OG here. Samuel Orton was a neuropsychiatrist and Anna Gillingham was a psychologist and educator. And they both independently came up with different strategies to help struggling readers. Back in the 1930s, it was called word blindness instead of dyslexia. So they came up with their own separate strategies, but then collaborated and developed what is now called the Orton-Gillingham manual, or the OG manual. Maybe that was the OG literacy collab. All right, I'm gonna stop with the OG puns now. I'm done. So let's take a step back for a minute and talk about how children in American public schools have been taught to read for the last several decades. There are hundreds, I don't know, maybe thousands of reading programs out there. Just to remind you, I'm not an educator or a reading specialist, so this is a layperson's breakdown of the information, but I will do my best. So in recent decades, the strategy in education in learning to read has been something called balanced literacy. And if you haven't already listened to the podcast called Sold a Story, I would highly suggest that you do that. I will be sure to put a link in the description box to help you find it, but it is riveting. So anyway, balanced literacy, in my reframing of it, is the idea that if you expose kids to words, if you put them in front of books often, if you teach them how to use clues from context and pictures, that they can sort of piece it all together on their own and they will learn to read. There is little bits of teaching phonics in there, but not very much. It's more about learning whole words and just jumping in and reading, and they'll sort of figure it out. And this does work for kids. It works for many kids, but it does not work for kids with dyslexia. And there are many other kids it doesn't work for as well. Also, children with dyslexia are masters of using context and pictures and other clues to figure out words so they can get through text. This is really how they're able to mask their dyslexia from adults for a good amount of time using this balanced literacy strategy. So it may be not until older grades when the words being shown to them in reading are kind of big and outside their vocabulary so they can't guess anymore, that an adult finally picks up on the fact that the child can't decode a word, they can't read. So anyway, over the years, many experts, including Dr. Shaywitz at Yale and experts across the country, have been doing research on how people learn to read. And we have a lot more information than we used to, and we now understand why this balanced literacy approach may not be the best one. This gathering of new information and realizing that maybe structured literacy may be beneficial to more kids than balanced literacy. This is a movement called the science of reading. And if you're interested in learning more about that, I will also put some links down below. But let's get back to learning about the Orton-Gillingham approach. Let me tackle that word approach, and then we will get through the 5 components of the Orton-Gillingham approach. The OG approach is just that. It's an approach, it's a style, it's a framework, but it's not a specific program. You may hear a lot of other names of programs that are used by different schools Wilson, Barton are some common names, but there are many, many others that are sort of little offshoots, babies of the original Orton-Gillingham framework. They are all effective programs for helping dyslexic children learn how to read. So when you talk to the school, it's not important that you say a specific name of a program, and most schools will not name the program they're using. It's just important that you're both using the same language of structured literacy. And I personally like to hear that the person who is providing the structured literacy work with my child has a high level of training in an Orton-Gillingham approach. So let's walk through the 5 components of the OG approach. Number 1 is that the instruction is direct and explicit. So that means the instruction is broken down into small, specific, focused pieces, and time is spent explaining it, giving examples, and giving very clear instructions on teaching the child how to use it. So for instance, the piece may just be learning words with ER at the end, and that is going to be explained very clearly. Lots of examples are going to be given. Lots of practice is going to be done with that with very clear instructions. The second component of OG is that it is sequential. The OG has very specific order that lessons are to be taught in. And so there are lots of OG instructors who stick with that initial sequence of teaching. So specific letter sounds, and then maybe combinations of letters that make sounds like ER, which I mentioned before, or then words with TCH. And there are hundreds of them, and they work through them in a certain order. Depending on the specific program that's being used, so Wilson may have one sequence, Barton may have another sequence. It doesn't really matter. I think they've all been shown to be effective. But the most important thing is that it's an order that makes sense for the individual child. So there are also OG instructors who have a sequence they tend to use, but will vary from the sequence if it makes the most sense for that particular child. And we'll come to that in just a minute. The third component of OG is that it is multisensory. So I'll admit, this one baffled me at first. I figured you just need your eyes for reading, and I couldn't figure out how you were going to use your other senses. But now that I've learned a little more, it makes more sense to me. So the multisensory is eyes for seeing, ears for hearing, tactile. So think like fine motor, that could be writing or using your hands for other things, and kinesthetic. I think I'm saying that right, but movement. So using their bodies to move around in ways that helps solidify what they're learning. The other thing that, as I was just getting started on this journey, I thought about was a lot of Orton-Gillingham instructors that you can hire privately provide their services over the computer, over Zoom or FaceTime. And I was curious if it would work to do a multisensory approach virtually. But I can say from my personal experience, it can work really well. The fourth component of Orton-Gillingham approach is that it should be diagnostic and prescriptive. So what does that mean? Diagnostic means the instructor needs to be capable of doing frequent evaluations, constantly checking in on where the student stands in their progress. And prescriptive means they need to be able to come up with a treatment plan or a learning plan based on that diagnosis or that diagnostic work. Essentially, it comes down to frequent evaluations and check-ins and then adjusting your instruction accordingly. The fifth and final component of the OG approach is that it should be individualized. As you can imagine, in order for an instructor or teacher to be able to be diagnostic and prescriptive, one-on-one is what works the best. But as you can imagine, many public schools just don't have the staffing for something like that, especially if you're talking about somebody who has a certain level of expertise. They're only going to have so many of those people on staff. So all this to say, you can try to fight for one-to-one but that may be very hard to get. It may be worth your effort though to advocate for very small groups, ideally no more than 3 students at a time. So that way the instructor, the teacher is able to put all these components into place. Again, doing diagnostic and prescriptive and multisensory for a group of 6 children would be really, really, really difficult. So that wraps up your education about the Orton-Gillingham approach. I hope you found this video helpful, and if you did, please be sure to like the video and share it with another parent or friend or anyone who you think might benefit from learning this information. Be sure to check out those links I referenced too. I'll put them down in the description box. And also, if you like this video, be sure to subscribe to the channel and click the bell so that way you can get notified when my next video comes out. I'll see you next time. Stay strong, parents.